Hello everyone, my name is Sage Otter. I am currently a second year student at Hutchinson Community College in the respiratory care program, and I'm going to be discussing antibiotic exposure in neonates. So the purpose of this is a systematic review on the relationship between fighting infections and the potential harms of antibiotic overuse on the overall health of our neonates. The method involved was evidence was collected from 9 randomized control trials, as well as 38 observational studies published between 1980 and 2016. So the topic at hand, the key points that we're going to be going over are going to be the empirical use of antibiotics for infections. Particularly, this one is going to be sepsis, as sepsis is the main cause of death in neonates, and late onset sepsis is the main cause of death for preterm neonates. We're going to be looking at how this affects neonates, particularly, like I mentioned, preterm, and the different outcomes that can come from using antibiotics too early. And those are going to be the necrotizing enterocolitis, invasive fungal infections, as well as death. So this study was created based on the following criteria: groups of preterm or term infants exposed to 3 different categories of antibiotics: yes versus no antibiotics, long versus short duration, and broad spectrum versus narrow spectrum. Duration was decided on the basis of 3 days, and cephalosporins or carbapenems as broad spectrum compared to aminoglycosides that protect against gram-negative bacteria. NEC was defined by the Bell stage 2 through 3. IFI was determined by the fungus, and death was defined as a causative of antibiotic therapy. This study concluded an epidemiologist, a librarian, a pediatric pharmacologist, and a neonatologist. And this study did exclude regards to oral bionics and low-dose vancomycin. Okay, so the first outcome that we're going to be discussing is necrotizing enterocolitis. And whenever they did this study, they found that prolonged empirical antibiotic therapy greater than 4 days after birth in patients without proven EOS was associated with increased odds of NEC compared with shorter duration. They did do a study on 964 preterm infants, and that also showed associations between duration of antibiotic exposure and NEC. And the outcome was NEC or death. The second thing that they compared was the difference between broad spectrum versus narrow spectrum. They compared ampicillin and cefoxamine compared to ampicillin and gentamicin. And the result concluded higher rates of NEC in the groups receiving ampicillin and gentamicin. However, there was 2 other studies done on this, and they reported no difference in risk compared to broad versus narrow. And the overall determination was that there really is no difference in risk of NEC whenever you use broad spectrum versus narrow spectrum as your regimen. So the next thing that this study looked at was the risk of invasive fungal infections after use of antibiotics. and this focused mostly on preterm infants. So the study was concluded with 24 different studies, and there was an alarming discrepancy on the exact definition of invasive fungal infections. And there was an even bigger discrepancy on exactly how they determined. So 14 of those studies, they used a positive blood culture to determine, yes, there actually was. 7 reported simply just on invasive candidas, and 2 reported IFI without really any further definition on what that meant. So the next thing that they had to kind of look at was, okay, what about duration? And they reported that there was really no increased risk of IFI after prolonged use of antibiotic exposure. Okay, so now we're going to be looking at narrow versus broad spectrum. So out of the 15 studies that they looked at with this, most of the antibiotics were broad spectrum, using cephalosporins as the main target. And out of those 15, 10 studies did report that there was an increased risk of invasive fungal infections after exposure to cephalosporins. So the last thing that they looked at was death. And they looked at a cohort study reporting that continued empirical antibiotic therapy greater than 5 days in neonates without a confirmed diagnosis was in fact directly associated with an increased risk of death when compared to shorter duration. Also, they did look at a study involving very low birth weight infants, and this also showed an increased risk of death once exposed to biotics for greater than 3.5 days. Now, this study also suggested that each day of added therapy increased the odds of mortality. However, on a more positive note, infants that were term were at very low risk of death. Nevertheless, results were conflicting when it came to broad versus narrow and how that played a role. And overall, there was no notable differences in mortality between broad and narrow spectrum antibiotic use. So there's a couple few takeaways to look at when you're looking at this study. I mean, you kind of have to play the odds. So, being in a hospital, there's lots of nosocomial infections, and being so small and, having an immune system that isn't fully prepared to be in a hospital setting for multiple days, especially if you're a preterm, you just kind of have to weigh the odds of whether or not you are going to wait for a confirmed diagnosis to start antibiotic therapy, or whether or not you're just going to use empirical therapy and prevent that from happening. Is kind of, which one is the lesser of the two evils? Because either way, we have to prepare for the worst, whether we decide to use antibiotics as preventative and deal with the outcomes that, could possibly come from that, or whether or not we risk it and try to treat the sepsis if that is what it comes to. The other thing was, there's really not a lot of research on this topic specifically, and that can be kind of problematic, to know really what the steps should be, or if it's possible to implement some sort of protocol. So overall, the main findings of this study suggested that empirical antibiotic use in preterm infants is in fact associated with an increased risk of developing NEC later in the neonatal period. It also suggests that use of cephalosporins comes with an increased risk of developing IFI. And treating preterm infants with antibiotics prior to confirmation of infection is flat out risky and can cause unnecessary death. So the basis of these recommendations, besides the fact that, they did suggest that there is limited research on this specific topic, like I previously mentioned, their recommendations were pretty simple, washing your hands to prevent infections, having antibiotic stewardship, and to maintain safe and effective use of antibiotics for those who need it. Antibiotics are really overused when it comes to neonates or adults, and as the years have progressed, we've really created a lot of resistance when it comes to treating with antibiotics. And I can see that being very problematic if we continue to go on this route of giving out antibiotics for anything and everything, and especially in our tiny people.